if you can take your seats, we're going to get started here today, and I'll give it to Michael.
Do you want me to use that or this one?
I'm not giving my mic away. This is my mic.
All right. Well, good morning, and actually it's afternoon at this point. So good afternoon, everybody, and welcome. My name is Michael Lochtefeld, and I'm one of the co-founders and directors of LOCAH. We appreciate you taking the time from your already busy days to be here with us. Thanks for joining us. A year ago this month, Nick Thompson and I, we gathered a group of healthcare professionals at an apartment building just down the street from Grant Medical Center. We wanted to talk about some of the challenges and frustrations we were having trying to communicate and work with area hospitals and to see what everybody else, what their experiences were. Across the board, it was clear there was a breakdown in communication and relations. There was a lot of challenges that were resulting in patient care issues, admissions that weren't going very well for us, upset families, upset patients. And the two of us said we have to get to a better space. And well, that snowballed, and that's how we ended up here today. We ended up biting off a little bit more than we intended to chew, but here we are, and we're excited to be here. LOCAH is a collaborative network of public and private agencies and individuals who are committed to the excellence in coordinating the needs for the Columbus area population as they are transitioning from the hospital setting. Our vision is to educate, advocate, and elevate communication for Columbus area professionals to best match the needs of those being served. We are very, very grateful to have the warm welcome of Mount Carmel. Thank you for hosting us, and I'd like to welcome Nick.
Hello, everybody. Thanks again for being here. I'm very excited to welcome our very first speaker. It is Diane Doucette. She is president and COO of Mount Carmel, New Albany, Mount Carmel St. Anne's, and Mount Carmel Lewis Center. With more than 30 years of experience in healthcare, she has been with Mount Carmel, New Albany since its inception in December 2003. The hospital has received the Press Ganey Guardian of Excellence Award for inpatient satisfaction 15 times since 2005, thanks in part to her guidance and leadership. In addition, Diane became president of Mount Carmel St. Anne's, a full-service hospital in Westerville and a beautiful meeting space, and Mount Carmel Lewis Center, an integrated health and fitness facility with a full-service emergency department in 2020. Prior to becoming president of Mount Carmel New Albany in 2015, Diane served in several leadership positions at various health systems across administration and clinical services. Diane was a principal in a consulting firm for 20 years across the country as a subject matter expert in peri-op efficiencies, patient experience, and architectural design of hospitals and ASCs. She designed and operationalized 5 specialty hospitals, including Mount Carmel New Albany. She is a member of the Association of Operating Room Nurses, the American Nurses Association, and the National Association of Orthopedic Nurses. She currently serves as a board member for the New Albany Chamber of Commerce, Mount Carmel Rehabilitation Hospital, and the East Wind Surgical Board. Diane received her nursing education from Canadore College in Canada, her bachelor's degree in business administration from Otterbein University, and her master's degree in business administration from Franklin University. Please welcome Diane Doucette.
Well, thank you. Thank you very much. I didn't know you were going to say all that.
You can blame Erin.
Thank you, Erin. Well, thank you so much for being here. To see the amount of people that have taken time out of their day to come here just reinforces how much you care about patients and families and what happens to them. And as a registered nurse, that just makes me so proud. I have just come back from Stella, Niagara, where our founding sisters, the Franciscan sisters, were who founded St. Anne's. St. Anne's has a rich history of helping people. Started out as an orphanage, St. Vincent down and on Bryden Road. And when the orphanage became too large and they didn't have enough room, they looked for land, and that's how they came here in the Westerville area, and it's just grown and grown ever since. A fun fact about St. Anne's that I didn't know until I came here, we didn't take care of men till 1972. It was women and children, so I thought that was a fun fact. But I'll tell you, what you do, we need to work together. We'll never go back to what it was before COVID. That's just not how, nothing is going to be the same. But that's okay. With change brings innovation and opportunity. And we really need to know as a healthcare system how we can work with you better, communicate better, share ideas together. And we really are happy to host you and to hear of anything innovative that all of you are doing, that we can learn from all of you, because together we can do this. We can get through this pandemic. We can be stronger as a community, and our community's counting on us. So I want to welcome you to St. Anne's. I'm sorry I'm unable to stay with you. I've got to go talk about a behavioral health project. But I hope you have a great day, and thank you for choosing St. Anne's to have your retreat. Thank you.
I'm Erin Harris. I'm the Director of Case Management and Social Services here at St. Anne's and New Albany. So on behalf of myself, Jill Sherg, the Director at Grove City, and then Kathy Ross, who could not be here with us today. She's out enjoying her PTO and on a cruise. But thank you all for everything that you do for our patients and your collaboration. And thank you all for coming today. I appreciate it. And then I'll hand it over to Natalie, who is with the advisory board.
Hi, everyone. My name is Natalie Moscato, and I'm the Elder Law Lead for LOCAH. I'm very excited to be a part of this organization. It is definitely, like we said earlier, much needed, I believe. So I just wanted to come up here and introduce our board. If everyone from our board will come up, please. So we have an advisory board. So I'll let each of them come up here and introduce themselves.
Oh, yeah. Guess I'll get it out of the way. Yeah. Good afternoon, everyone. My name is Melissa Swemba, and I am with Kindred Hospice, and I am the treasurer on the executive board.
Hi, everyone. I'm Ann Farley. I'm with the Ganshorn Suites, Specialized Memory Care Assisted Living in Powell, and I am the memory care lead.
Hi, everyone. I am Brooke Justiniano, and I am the home care lead on the board. Thank you.
Hi, everyone. I'm Angie Hoff, and I'm the NP and PA lead.
Hello, I'm Patrick Carl, and I'm the Independent Living and Assisted Living lead on the board.
Hi, my name is Olivia Huffine. I am the SNF lead on the board and also on the orientation committee.
Hi, I'm Dr. Joette Greenstein, and I'm the hospice lead. Thank you.
And I'm Ashley Stewart. I am the home health lead, and I am also going to introduce the rest of our sponsors for today. So I am going to have Jill and Lindley come up and just speak a little bit about their organizations.
Yeah, go ahead.
Thank you so much. I'm Jill Edwards, Marketing Healthcare Navigator with Otterbein Senior Life. To Michael and Nick and to this wonderful board, thank you all so much. To the Mount Carmel system, we are so grateful for this opportunity and just thankful that you allowed us to be a sponsor for this wonderful event. And it's so wonderful to see so many familiar faces. Hello to everyone. Just wanted to chat really quick about Otterbein Senior Life. We have one of the smaller footprints for our organization in the Columbus area. Most of our company is based out of the Cincinnati area and near the Marblehead, Toledo, Akron area. But here in Columbus, we do have our 2 small houses in Gahanna and in New Albany. And what that means with our small houses, we have 5 houses with 12 elders in each with private suites. We do offer long-term care and rehab, and we've recently added a wonderful asset, our newest CCRC, which is Otterbein Granville. Melissa, our representative, is here. If anyone wants to meet with her and speak to her after to learn more about Otterbein Granville and what we have to offer there. Again, I just wanted to say hello, thank you all, and we're grateful to be here on today.
Good afternoon. My name is Lindley Ledger. I'm the Director of Community Relations for Home Health Care Services. We offer non-skilled private duty care in Columbus and surrounding areas. So just to kind of give you an idea, what does that mean? Private pay aid. So if your loved one is at home and needs someone to help take care of them, maybe they live alone, we can help provide that care. And we are available 24/7 around the clock. So that's the other thing. Yes, I get this question quite frequently. I have caregivers. We're one of the larger non-private medical companies in Columbus, and we have over 200 caregivers. So yes, we really do have the availability for you. As a personal note, it's kind of fun to be up here because I used to come up here and present when I worked for Mount Carmel. And that's where I got my start in senior healthcare back in 2010. So this is kind of surreal. So thank you very much for having me, and I hope you enjoyed the food.
Again, I want to thank all of our sponsors, including Mount Carmel St. Anne's, for letting us use this, nice large space. We aren't cramped in like our meetings used to be back in an apartment down by Grant. So now I'm going to have Olivia come up. She is from the orientation committee, and she's going to do a little brief overview on how the website operates.
All right. Nick? Okay, perfect. As part of orientation committee, my job along with Patrick, we are going to be orientating new members and current members who don't know what they're doing. I'm just kidding, all of us. There's a lot of information that we have put together for you guys. So we just want to make sure that you all know how to utilize that as best as possible. And I'm going to try to do this really briefly. So as you can see, Nick has the website pulled up. This is LOCAH.org website, and this is where you will find the majority of all the information that you guys, all the resources we put together. So on the home page, you can see upcoming events. So on the left there, you have the upcoming meeting event, and then on the right, you've got the orientation that we do every month online, and you can see that's the link that you can find it at. So that is for orientation for new members. So if you're like, man, I could really use a refresher, this is where you can find that information to get onto that Zoom call. We do it the first Thursday of every month at noon. And we did our very first one this month, and it seemed to go pretty well. So our next one will be the first Thursday of November. So if you're like, man, I really could use a refresher, this is where you can find the information at. The very first thing I want to show you, though, is the directory. Awesome. So the directory, well, sorry. You got the directory open, Nick? Okay. Okay, so login credentials for this directory are provided during orientation and will be in the orientation guide provided to the members. We are currently hosting over 300 contacts. Our tech committee will be updating this monthly, and members are able to update their own contact if there's been a change. And we are also asking that if you have had a change, it would be really helpful for us if you would go into this directory and update your phone number or your address or whatever it is that has changed. What's also really nice about this directory is that it is searchable and includes labels located on the left side. So search criteria currently includes label, or is by label, location, business name, parent company, contact name. Let's do a demo really quick. Let's search for Solavita. Alrighty, let's, so you can see when we search for Solivita, I can't really see it very well myself. So there's just different options. You can see everything that comes up when we search for Solivita. The next thing we're going to search, perfect, thank you. Okay, so the next thing we're going to search by is zip code. So 43230. So you can see everything in the zip code of 43230 will come up, and it's really nice because then you can just go in and look specifically for what you're looking for in that area, okay? All right, and let's do the last search example, skilled nursing 43230. So then we can even take it a step further. In that zip code, we can then take it to, we're looking specifically for skilled nursing, okay? Okay, so if there's a Trilogy facility, then who is the liaison for that Trilogy facility? So let's search Trilogy facility or liaison.
And it's me.
It's Nick. So you can see here, like, you know, it's got Nick's title, Nick, all of his contact information, what the services are that they are associated with, and how to get in contact with him. So it's really helpful. Okay. We look to enhance search criteria in the future for specific needs, insurance, and more. Back to the resource library. The next thing we're going to talk about is the LOCAH Drive. These are notes for recent and our new members, hospital guides, and how to get access to that. So you can see here, there's like a ton of different resources. Like I said, this is going to be the top place for you to go to find all the resources that LOCAH has available. And really specifically, the top resources are the directory, which will give you the information for all of the members, and the hospital guides, which you will find in here. Okay. All right. Let's go to contact LOCAH, Nick. So the last thing I'm going to talk about is how to contact LOCAH. There are two different ways to contact LOCAH. The first way is if you are having a hard time finding services for a specific set of needs. You can email our membership base, and this is what's really, really cool about LOCAH is that when you send an email to us, we will read it, make sure it's fine, and then we will send it out to the entire membership base of LOCAH. So if you have a specific need that you're looking for, you need help finding placement for a patient that you can't, otherwise find, you can send us an email. We'll send it out to the entire group, and that way you'll have over 120 or 130 people able to help you in that moment if you're looking for something very, very specific. The other way that you can, or the other reason why you would want to contact us is if you have any questions or comments about LOCAH just in general. And we are happy to answer those, and that's to the board. So those are the two different ways that you can contact us. Any other questions? All right, thank you.
Hey, Olivia, this one. Hello? Can you hear me? Okay, cool. One other note too, and just for like the case managers and social workers that are in the room and online, this is a big part for you too. This is not just for us as members to be able to ask us for help, but for you with your care coordination, if you're running into those barriers, we want you to email us so we can have all of LOCAH help you with that part of it. That's a key part to just note.
All right, thank you. So at LOCAH, we've got 3 different boards. We've got an executive board, we've got an advisory board, and we've got a hospital board. So I just want to take a quick moment to recognize the folks that are on our hospital board. So as I say your name, if you don't mind just standing up and giving us a good wave. We've got Jennifer O'Brien. She's Mount Carmel's Regional Director of Case Management, here in the back. And we have, thank you, Diane Copeland with Select Specialties. She is the Market Director here. Thank you. Courtney Starr from Reunion Rehabilitation Hospital. Today she's actually represented by Eric Mueller, their CEO. Eric. And we're happy to announce that we are welcoming Marisa Campbell. She is the Director of Operations of Care Management for OhioHealth. Welcome, Marisa. A couple quick hospital updates. So we are working with Marisa to be able to incorporate information from the OhioHealth hospitals into our LOCAH guide to help you better connect and better follow your patients who are hospitalized, to better follow patient referrals. We know it can be very difficult when people move from floor to floor, having that good communication and knowing who it's handed off to. So really looking forward to that information for you guys. The next thing I have is in reference to Mount Carmel Rehabilitation Hospital. So Mount Carmel Rehab Hospital is a little bit different. They do not utilize Epic for a referral platform like the other large systems do. They actually use a referral tool called CarePort. Is anybody in here familiar with CarePort? Not a lot of hands. It's not very popular in Columbus. It's a lot of other markets, but with CarePort, it is still possible for you to easily receive referrals, even if you're not registered with that platform. They will send you a one-page fax cover sheet that has a referral code and a password. You enter those into the website extendedcare.com. It'll allow you to view that referral online and still be able to easily access those, saving them from sending you the old-fashioned fax of 40 pages that takes forever. So a lot of people aren't familiar with that, what that sheet looks like, the CarePort sheet. If you see something from CarePort with a referral code and what have you, that is what that is. So that's a referral. The other note that I have here, is to welcome Jennifer to the stage.
Thank you, thank you, thank you. So if you're wondering why we're using mics, because most of you who've heard me talk before know I could fill up this whole room without a mic. We are showing this on Teams, so our case management folks outside of St. Anne's for Mount Carmel can be on this. We would like to offer this in the future for other facilities that have staff who can't get away and come see this. So let us know, and we would be happy to make that work for you. Because this, as Nick said, is for the end users and everybody, so we help our patients. It's not just for me. So I wanted to let you know that. The other thing is we didn't really do a good job of letting you know kind of some of the just meeting things. Someone asked me where the restroom was, and I gave her a healthy walk to the place where I knew the restroom was, because I do not come here in this meeting spot very often. So I did find out there's one right outside the door. For the person that had the health, make sure you make a note when you put in your miles today that you walked because of me. So, but there's one right outside the door. If you're still hungry, get up, get some food. As you can see, we have plenty. Don't worry about that. And then there's trash cans in the back. One by Nick, I see one in the middle and one underneath the little computer back there. They're kind of hidden. So I wanted to say that. One of the things we talked about when we got to the board is wondering what's going to happen coming up this fall with holidays. There's this huge fear in the US or the world that COVID or the flu are going to really jump out again. So we just wanted to kind of have some talk or communication. If any facilities are worried about what's happening in the upcoming holidays, if you're going to close or not take admissions the day before Christmas or the day after Thanksgiving, whatever it is, because insurance companies usually close, but there's a lot of problems with staffing nowadays, and somebody's calling me right now from Milwaukee, Wisconsin. So we just want to know that. So if you could send us anything that you may have happening that may cause issues for patients that would help, like if I know a facility isn't going to have staff on the Friday after Thanksgiving, it makes it a whole world of difference for our case managers to know that on Monday of that week, not finding that out Wednesday at 5. So if everybody can work together, and if us hospitals can give you information if we're not going to staff something, please, we just want to do that communication. So if you can send it to the board email, that would be great, and we can keep track of it for everybody. Any questions on that? Okay. So the next thing we have is we sent out in the invitation that if you had a chance to talk to the hospital's case management teams, what would you ask us? And I can tell you, when I saw that email, I was sweating bullets. What are they going to ask me? But we had some great questions. And then this past Monday, we pulled the hospital board representatives together and we came up with answers. So it wasn't just one way. So I'll try and summarize the questions because I know I hate it when people read to me directly. Oh, and by the way, did you guys know? Oh, it's mostly the board figures, isn't it? These are the VIP tables. You know, if I was Celine Dion, these guys would be paying thousands of dollars up here. And it's our board. Oh my gosh. Okay, so to the questions. So a physician has sent us a patient referral prior to an elective surgery. And that physician, the surgery hasn't happened. So I'm just going to pick a case I know. So like it goes to Summit Home Health. A physician talks to the patient. They say, we want you to go to have Summit Home Health after you get out for the surgery. And then the patient comes to Mount Carmel and the patient discharges. And what do? We set the patient up with Mount Carmel home care. So the question is, why are you doing this? Well, the number one answer from all of us is we don't know the physician set it up. That's the number one thing. If they don't put it in their note, we have no idea. And we go in to a patient's room and say, you know, we think you might need home care when you go out. And they say, yeah. And we say, here's a list of them. Is there a place you'd like to go? And they'll say, no. You anything? And I say, well, we have Mount Carmel home care. Is that okay? And they say, yeah. And so that's how that happens. So what we need is if you have a referral and you know that patient's going to go to Mount Carmel or OhioHealth or OSU, reach out to that case manager director. Let them know you got this referral. The other thing is we're going to work with our providers to put that in their notes. But unfortunately, as you know, providers sometimes don't think about that. They think it's all taken care of. And if any of you have a better idea, please let us know. Because to be quite honest, it's easier as a case manager to know it's already set up. So we don't want to do the other work and send them more referrals if it's already set up. So that's that one. And then if you have questions, you can stop me. If not, I'll go on to the next one. What is the process of opening, closing, and updating referral sites when a facility has closed? We have facilities who do not operate anymore that are still getting referrals. So you just have to let the directors at the sites email directly the director and tell them, we at Mount Carmel have to submit a service ticket to Epic to get it pulled off. And just another quick thing is we don't locally set up all the home cares and skilled facilities. It comes from a service such as like Aunt Bertha or Careport. So it may be a national thing that may have to do, but if we submit a ticket, it gets pulled off our system. So that's that one. Okay, this was a fun one. Is there a reason behind the delay in discharge transportation for the hospitals? But what I really liked about it, it had OhioHealth in there at first. But I agree with the exact same thing. So we talked to it. The problem is the shortage of transport. We have patients that have a discharge and are ready to go at 11 a.m. and we can't get an ambulance or a transport till 5 or 6 p.m. at night. So for some of you who have been at another meeting, you know Mount Carmel sent into a contract with TriStar to try and improve that, to get those patients to you sooner. We want the patients to leave when they're ready, which is usually earlier. So we are not the reason, but it's transportation. If any of you have transportation and can do it, please let the hospitals know. We'll utilize you because that is the best way. We want them out at the right time too. But yeah, you can always put OhioHealth in there on those questions. Our company is having issues with the AVS at discharge, missing prescriptions, missing orders. They don't always get them. And I have to admit, this is Mount Carmel. We do know that's a problem. We've put the committee together. We're unhappy about it. We know for sure there's been 2 readmissions caused because of our lack of our quality of our AVS. So we are working internally for that, and we have submitted changes to get the AVS changed on Mount Carmel's end. The other thing is the big part about this that worries me is they made the statement that if the patient comes at 5:30, 6 o'clock at night, they can't get their medications till the next day. And I know from my system, many of our patients are coming at that time or later. And that really worries me because that's poor patient care and we're the cause of it. So on that, we had a long discussion, and some of it's Ohio regulations, some of it's other stuff. We would like to develop a small committee to look at how we can get you those medications sooner and how we can work with our pharmacies that if a late patient discharge is happening, the patient comes with those meds. I have done that in other states. This is another thing that's kind of Columbus or Ohio. It's the regulations here. OhioHealth will tell you, OSU will tell you. I've been told many times by my pharmacy head, we cannot do that. So, but I don't take no for an answer very often. And so we're going to get a committee together and work. If you want to be part of that committee, let Michael know. Is it you? Email the board because we want to fix this. Now, the other part of this that we need to know is we need to know as soon as real time when those AVSs are bad. Because how I found out is the readmissions. We've been asking, are these AVSs good? Are they good? And when the readmissions hit is when we realized, oh, these are terrible. There's a shortage of nurses. It's a shortage of nurses for you. Yes.
Us non-skilled nursing hospital people, what is that acronym?
Oh, thank you for putting that out for me. AVS is After Visit Summary. So in the Cerner world, which Mount Carmel used to have, it was called a clinical summary. For Epic, it's called an AVS, After Visit Summary. So it's like your list of orders from the discharging doctor, follow-up appointments, those kinds of things that you needed. And we were basically told Epic Care Link, because many of you have Epic Care Link, you can see everything. So let's not worry so much about the AVS. Well, I sat with Michael the other day and went through a case we had sent him. It isn't that easy. You can't see everything. So we need to get better on our end. So we're going to get that and get it better for you and get those fixed, but we need your help on the pharmacy part. I'm going to invite pharmacy heads from all of the hospitals, and we're going to solve this problem. So that's one of the things. So thanks for that question. That was huge. Do hospitals provide lists of home health providers prior to assigning? Yes, we do. That's a requirement. All the hospitals do. Do they lead with their preferred home cares? Yeah. Be very honest with that. But we give a list and we inform them. We are required to inform them. We have Mount Carmel Home Care, but we have a financial relation where we need to let you know that. But you can pick any of these. So, what is the best way to introduce a new company to the hospital system? That was a fun discussion, wasn't it? I think the best thing is reaching out to the directors and meeting with them. All the hospitals have things called huddles, 15-minute huddles. We call ours tiers, same thing. If there's a really big change or something coming out, you can get a time set for that. Those are the best ways. We do get emails and we do send them out to our staff, but many of you get emails and you know how that goes. If it's not something, it doesn't really change behavior or catch on as that. So reach out to the directors at all the hospitals and use that time. We did talk about having maybe like a community resource at a hospital where you set up little booths and hospital people walk through during the day. I'm going to research that, see if we can do that. I've done it before, but I'm not guaranteeing all hospitals will be able to do that. What can we do to educate and build confidence for hospital discharge planners to take advantage of assisted livings and memory care? We would love to use assisted livings and memory care. So the biggest drawback that most of us said was our experience for our case managers in the past is it cannot be set up in 24 to 48 hours. That's our experience. It's not saying it's the truth. So as I said, easy buttons, staff go to what they know. Also, therapies, they review for home with home care, or SNF. Anyone here assisted living or memory care in that? Yes, it's to home, but that's not thought of. So we're going to educate our staff that if it's home with therapy, that can be assisted living with therapy. If it's SNF with therapy, is it because they need 24-hour supervision? What is it? You can look at different ways of doing it, but it's really the time frame to get the patient in. So one of the things I've had in the past, well, the family has to bring the furniture. Well, then I talked to Jim, and I know they have kind of like a respite room or something. And so we talked about how we could maybe use that for a day or two or a week until the family gets their act together and gets a room set up. So if you can let us know if you have that availability, we can start calling you more. And once we have some success, then it will go a lot quicker. Okay. Whoa, and then another assisted living. We frequently have assisted living residents return from the hospital and nobody calls us and nobody tells us anything. That's because, first of all, it should not be happening. We need to know when it does. You call or reach out to the director at the site because we can't change behavior if we don't know. This is the first I've heard of it coming to me, But I think a lot of times nurses on the floor think, oh, they're going to home. And they don't even look any further. So if we in our area can hand off better to the nurses that's assisted living, call here. And if it happens, please reach out to the director so we can solve it.
My sales manager at Lakeview helped resolve that, like with Mount Carmel East years ago, when she said, why don't they put us, in that time it was Enzo care, why don't you just put us in Enzo care so we'll get a referral for our own residents that's coming back to our own building? That actually worked really well.
Yeah.
So the same thing with Hayden, Epic, whoever, that would be an easy solution. And maybe even for private duty, if private duty people have.
Mm-hmm.
And we're going to talk about that later.
Okay.
Okay, yep. So they got that.
I'm outside of the script, sorry.
He must have got a secret copy. So.
I'm sitting at the executive.
Okay. So does anyone have any other questions they would like to ask case management? That was the one sent in, but is there anything else you'd like to ask?
I have a question.
Sure.
We've also talked about home care. I'm interested in knowing, do you work with referral agencies like we? What we do is we have knowledge of the community throughout Central Ohio. And so we can help case managers as they are discharging and figuring out what's best for the family. So have you worked with someone like us? And if not, why?
I have to say, I have worked with someone like you once in the past, but it was in a community I didn't know the resources. For a community like Columbus, where we're already working, we don't seem to do that. Any other? Yep. So the question is, and I may not have heard, how does guardianship work with setting up discharge plans with the case managers?
So I'm a guardian. I work with all the hospital systems, but at times we have trouble getting the case managers to call us back, even when we send letters of guardianship showing that we are the guardian, we're the decision maker, but they still don't fully understand and work with us. And they say, well, we've got to talk to the client.
Okay, that would be a case, please reach out to the director. I do agree with you. We want to work with a guardian. If there's a guardian, that's who we should be working with. But here again, we do not a great job in documenting in the record who the guardian is. And we go off notes where a provider may have called somebody and it's not the guardian. Jill's laughing. She's like, oh, yes. Yep. And so please, if that is happening, reach out to the directors at the sites because we need to solve that and end it. Yeah, so you gotta go. Okay.
So I would say that sounds like there's a lot of opportunity. Why don't you reach out to the board and we'll see how we can try to tackle that. I do know that I worked with your clinical director previously and you guys should have Epic access at the area hospitals. So you should be able to at least clinically follow your patients for the guardianship board specifically. But yeah, reach out to the board and if there's other concerns like that, we'll see if there's anything we can do for you.
Yep. Sounds good. Okay, I better get off and turn this over to Ashley.
We're going to have Dr. Greenstein come up. Dr. Greenstein has a nice little presentation for us on House Bill 120.
Thank you, Ashley. Does anybody know about House Bill 120? Got a few hands. Good. I wanted to present this because, we've had a rough 2 years with COVID, and we don't know what this fall is going to look like. So I want to make sure everyone understands if we start getting into another situation of a pandemic or some other state of emergency. So I got involved with House Bill 120 because when we were at the peak of pandemic, there were a lot of facilities that were not allowing visitors and not allowing home health agencies and hospices and many more providers. And in 25 years, over 25 years, I don't want to give away my age, of being a physician, I've never been in a situation where I was kept from seeing my patient. And I had a patient in a facility and I had to see her through a window. So this is my patient, and she is a patient with dementia. And she's somebody that, I had a good relationship with, and it was just heartbreaking because I had to see her through the window. It was like February, it was freezing. I'm wearing a coat with a hood and mittens and a hat, and I actually scared her. I mean, she didn't know who I was. She unfortunately didn't have her hearing aids in. She was just put in front of the window, and so it was not a good experience. So House Bill 120, it's been called the Caregivers Act. It was sponsored by Representatives Frazier and Richardson. It was actually, they tried to introduce it in December of 2020. It was like November of 2020, but they couldn't get everything, in the works. And then when the new year comes, they have to start all over again. So it was introduced again in February 16th of 2021, and it was passed in April 6th of 2022. And its effective date was this summer, 7/21/22. And I actually was there. It was an interesting experience. It was at the State House, and they wanted testimony. So there was a lot of family members discussing their patients, their family members, how they couldn't get into the facilities. And then I was a physician that presented a testimony on my experience. We can go to the next slide. So I have handouts of the bill. So you're welcome to these. It's 5 pages. I'm not going to go through all that. I just wanted to give some highlights for you of what I thought would be significant. So as of July and going into the fall, there has to be access for healthcare workers. So long-term care facilities must permit healthcare and other workers who are not facility employees to enter the facility to provide direct care to residents or essential services to the facility. And this will include hospice care, emergency medical services, laboratory technicians, social workers, hair salon personnel, home health agency, dialysis technicians, radiology technicians, clergy members, and contractors conducting critical care maintenance. The other big part of this is the compassionate caregiver visitation policy. So this has to do with the family members who want to visit. They are requiring each long-term care facility to develop and implement a visitation policy that applies during an epidemic, pandemic, or other state of emergency. The policy must be developed and implemented within 30 days after July. So if you haven't put those into place, we need to get those in place. A long-term care facility is an institution, residence, or facility that provides for a period of more than 24 hours accommodations for 3 or more unrelated individuals who are dependent on services of others. So this includes SNFs, ALFs, home for the aging, veterans homes. group homes. Okay. So I have a link there that will take you to the House bill. And then I have handouts too, if you want to come up to me and grab a handout. But I just wanted to let everybody know so we can get prepared. Hopefully, we're not going to have what we just went through in 2 years, but I think it's important that we don't know the future and we may have another superbug out there. But these were in place so that we can continue to take care of our patients and provide them the best care and have a safe way for their family members to also be a part of their life.
I'd just like to say thank you.
Yeah.
This is incredible. This was the hardest thing for me to witness during that pandemic, was the demise of our loved ones and our elderly, and there was nothing that any of us could do about it. It was heartbreaking. So thank you.
Yeah, you're welcome. Thank you all. So I'm not up here to get applause, thank you. But yeah, I mean, you know, I'm glad I was a voice for you guys. I know the frustration, and I know you guys in the facilities were frustrated as well. So there's no blame either way. It's crazy time. We've never been through a pandemic, right? So, you know, we did what we felt was best to make sure our patients were safe. So now, you know, hopefully it's out of our hands as far as what to do, and, you know, hopefully we can do better moving forward. So thank you. Brooke, I'm going to introduce Brooke, who is our home care duty liaison. Sorry, it's hot.
That's okay. Hi, everybody. How's everybody doing? Need a stretch? That's a lot of information. Well, lucky you, I have more information. So there are some changes to the home care providers, that's non-medical private duty. Beginning October 1st, we have become regulated. Raise your hand if you knew that. Did you know that we weren't regulated? Well, now we're going to have quite a few different changes to our onboarding of caregivers. There's going to be more intensive background checks and fingerprinting that is going to be mandatory. If not followed, it's going to be a misdemeanor. So they're going hardcore for this, which, you know, can be a good thing, can be a bad thing, but we're also going to have to go back and go through our actual caregivers that are on payroll already. So that might eliminate some of our staffing, which if you are in home care, you know staffing is a continued issue. Well, I think everybody here knows that, right? And then let's see. There's also going to be a new residency requirement, and that will incorporate more background checks if they cannot prove a 5-year U.S. residency. In this industry, we know that we have a lot of great caregivers from all over the world, so that might cause some issues again. And then lastly, I'm just going to keep it really brief. If you're in home care, you already know all of this going on, and it's a headache. But if you have more questions, you can ask any of us, because it's rocking our worlds right now. But just recently, many different hospitals have brought to our attention that home care representatives are being in the hospitals with family members for care meetings, and they are kind of stepping on nursing and care managers' toes, meaning they are questioning the care plans, they are questioning the professionalism or the professional opinions of the medical workers. So there's a blurb in here. The case managers have expressed that they're open for interaction, but maybe taking it to the side, not in front of families, because that does introduce a insecurity in families' minds that their care plans maybe aren't accurate. So as the neutral representative for home care, this is something that I think we could all get better at, just letting people do their jobs. And if you're not confident, or if you have some kind of input, keeping it professional and out of the eyes of families. Any questions?
I have a question.
Yes.
Who are you going to be regulated by, and then does that change anything when it comes to like insurance coverage?
So it's going to change everything for every part of the industry, and it's through Ohio Department of Health. Our records are going to be regulated. Our people are going to be regulated. The people that we do hire are going to have different levels of care if you conditionally hire them. that they are able to provide hands-on care or non-hands-on care. So it is not going to just affect home care. It's going to affect everybody from the client, the care partners, the hospitals, the care managers, the case managers, you name it, it's going to change the whole look of the industry for us. Any other great questions? Yeah. October 1st, 12 days ago. Yes. So that's a great question. So as every home care provider can attest that the rules are still in the draft stage, although they are holding us accountable for being regulated, they have not finalized that. That's a good idea though, I really think that is, but then you come into accepting input from clients and like BBB, people, the ones that are upset complain and that ruins it. So I have no idea how to answer that because they don't even know how to answer that. But there was another question. Did you have another question? Is that it? I thought somebody else did. Okay. Well, Natalie Moscato is back up at the mic. Thank you.
Okay, so just to go over this quickly, I'm Natalie, I'm the elder law lead, so I just want to touch base a little bit on that. Last meeting, we talked a little bit about financial power of attorney, mostly because we chatted with Jennifer and she said that it is a huge issue if a patient becomes incompetent while in the hospital system. And if they don't have the appropriate financial power of attorney that gives the appropriate powers, they're unable to do certain things. So in our survey this month, which we'll touch on surveys in a little bit, we just proposed some questions. Are you partnering with an elder law attorney? Do you notify or do you check and see if your patient or if your clients or your resident, do they have the appropriate financial power of attorney? So a lot of you wrote back saying that, no, we don't check on it, or no, we haven't partnered with anyone, or we haven't done any education. So the biggest takeaway I think we got from the survey was that you really need to partner with an elder law attorney just to make sure that you are educating yourself on it, educating your residents, and making sure that they do have the appropriate financial power of attorney. And then also, as Olivia showed us earlier up here, you can find resources under I think it's the elder law, Nick, can you find it? If you click on that tab there, there's one, and it's the handout that we gave away last meeting, and it has information about financial power of attorney and why it's so important to have the appropriate one to help avoid guardianship if all possible. And then it also has information about Medicaid and navigating Medicaid as well. So I will go ahead and turn it over now to Ann and Patrick about assisted living.
Hi again, everyone. So Patrick and I are just going to literally speak for 2 minutes about the amazing opportunity that assisted livings and memory cares are going to be given by being able to receive referrals from Epic and through Epic. You gonna do? Oh, okay, so Mount Carmel and OhioHealth are open to granting additional access to Epic for assisted living facilities, which also will include memory cares, to follow hospitalized patients and residents and receive referrals for the placement. To make this feasible, they discussed the need to be able to admit within 24 to 48 hours of receiving referrals, and also consider having a respite accommodation available if occupancy permits. And ALFs, of course, vary in their level of care. So review on-site and approve or reject based on our capabilities.
Also, keep in mind that referrals to assisted living facilities are often with the recommendation of therapy for a home setting. In those situations, while some of the assisted living facilities also have SNFs, keep in mind that in these cases, patients should admit to an ALF without a SNF stay required. Also, instructions were provided earlier on requesting a new site access. And these details are also in our hospital guide. And for all those present who work for assisted living facilities or memory care communities, at the completion of the agenda, Ann and I are going to be meeting with you folks at the back table here in the corner. And what we're going to do is we want to create a questionnaire that can be provided to patients and their families so that we can gather financial information, whatever is necessary for you to make an informed choice, whether or not you can serve a particular patient. So with that, I'll turn things over to Ashley.
Thanks, you guys.
Just kidding. We have one more update for SNFs. So this is really important information because the current Medicare waiver under the public health emergency ends today. So you are no longer able to admit a patient to a SNF under that waiver program anymore. We must go back to the 3 midnight stay for all of those Medicare patients that were admitting that are going to be admitting into a SNF. So I just wanted to make sure as the SNF lead that all of you guys are aware of that information. It is very critical because we've been operating, yes. They did extend it? Are you sure? I just looked. Okay, perfect. If they've extended that, then that will be great. But the last information we were given was January or was today. So 120, can you what? That would be great. I would appreciate that. I'm sorry, never mind. That might be changed, but I just want to make sure before you guys are admitting anyone, double check that waiver program because I believe that it was originally supposed to be today, so I hadn't heard of the extension. Are you guys aware of that? No?
But as you all probably already know, if it is not in, if the waiver is not there and you take them, it is on you. It is not on the hospital. I'm not saying that get out of them. We're trying not, but you let's make sure.
Yeah, we need to be diligent in that process when we're admitting patients who might fall under that waiver. So thank you for your information over here. All right, that's all. Here's Ashley.
All right, so we're just going to go through some brief committee updates. So new member, if you are not a new member yet, we would encourage you to go to our website to apply. Applications are reviewed and approved within 30 days of applying. For 2023, the applications and renewals will be announced after our November board meeting. So you will have to renew your membership. So if you're a member now, you will have to renew for 2023. Those changes and information will come out again after our board meeting in November. Events committee updates. Our December meeting is going to be a members only meeting. So again, not a member yet. You have plenty of time to get that application in to be invited to our December meeting. We will have a brief information session, LOCAH board member updates, and then most of that meeting is going to be a fundraiser format again to come, but there have been a lot of expenses that we have, entailed over the past year. And so we need to, start having a way to fundraise and things like that. So again, you must be a member to participate in that December meeting. That December meeting is going to be over at Verena at Hilliard. And it is the second Thursday of December. It is at a different time. It is going to be from 3:30 to 5 versus our regular 12 to 1:30. So if you want to kind of put that in your calendars now, I believe it's December 8th, 3:30 to 5 at Verena of Hilliard.
Orientation committee, again, virtual orientation is the first Thursday of the month at noon. No RSVP is required. You can find the link on the LOCAH.org homepage, right underneath upcoming meeting information. Tech committee, your survey comes out the third week of every month. Those surveys are mandatory. So please keep that in mind as a member. We do need those surveys. You know, all of those questions that Jennifer went through today were all created from those individuals who did answer the survey. So with that, if you have email updates, work changes, please send that information to the board so that we can get your profile updated appropriately. Yes. Okay. That's the last update I have before closing, so.
December meeting is actually on December 8th, the second Thursday, correct?
Correct.
So it's on your paper, it says the 12th, just to make sure that you mark that down.
Good to know, yes. So December 8th, 3:30 to 5. So we want to thank all of you for coming out today. Thank you to St. Anne's for letting us use this space. Thank you to Lindley and to Jill as our additional sponsors. Again, if you are from assisted living, if you are from memory care, even if you previously worked within that industry, please go over, please see Patrick and Ann. We would like to get some information from you so that we can work on a flyer to be able to provide to the hospitals so that they can better connect case managers and everybody with families, and so that we can get people appropriately placed in AL and memory care. All right, thanks everyone.